Well, good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets, and it is April 4th, 9:02 a.m. I want to thank everyone for taking the time to join us on our Monday morning conference calls. And, it's getting busy. Believe it or not, it's still busy out there, especially if you're in the Florida market or even in the Southern California market. There's lots of five-star plans that are still out there to write and help people enroll. So very excited to guide you on that mission to help improve the lives of our community with affordable health care. That is why we are here. And so I really do appreciate everyone for being a part of that mission. As a reminder, we are posting lots and lots of videos on our YouTube channel, including these calls. So if you haven't subscribed to our YouTube channel, go out there, type in Health Plan Markets. I think it's Health Plan Markets Orlando. You should find us out there. And we'll be glad to make sure that we send you the updates whenever we have a video update. And we're going to have trainings and updates and all sorts of stuff. So make sure that you're subscribed to the YouTube channel. And also, just in case that you do get busy and you're unable to join our lovely Monday morning conference calls, those will be posted there. So I did a quick update over the weekend, and so we have all the calls uploaded. So if you missed a couple of those, go on out to our YouTube channel and you can see those there. All right, in the same form and fashion, let's jump into training. I'm going to go ahead and share my screen here. And so there's trainings, lots of trainings happening. And, we're going to start to get into training season here as we get ready for open enrollment or for that matter, selling year 2023. Just as a quick heads up, the AHIP is going to be rolling out in mid to late June, which is pretty much what they do. So you'll see, lots of trainings from the carriers for 23 starting to pop up right around that time. Don't delay, as normal, I always mention, please take the time to carve out your certifications and get all those rolling. AHIP is number one, and that should start happening in June. But so it's April now. We are in lock-in for Medicare. We are in lock-in for ACA, but there's still lots to do. So the first thing during this slower time of year is that you need to get faster, smarter, stronger, and more efficient with your business. So you need to work on your business at this point. Not in your business, you need to work on your business. And working on your business means improving your knowledge base, improving your systems, improving your efficiencies. So we're going to talk a bit about that today. The first thing is we've got rolling webinars here at HPM, and we're going to be updating that page, but I'm going to bounce you over to our webinar page, joinhpm.com/webinar. If you go to our webpage, it's right there. So you'll be able to jump in there and see all the trainings that we have that are rolling throughout the week. So you just pick a topic, whether it be ACA training, we've got our co-op marketing match program, HPM shop, most importantly, right? And then we've got the Clever RX. Now, we are launching on our training calendar 2 brand new trainings this week, and they are called Working with Providers, Working with Doctors. And we have a part 1 session, and we also have a part 2 session. So I'm going to talk about those this morning as well. So part 1, Working with Doctors at 1 o'clock tomorrow, Wednesday at 4 p.m., and also Friday at 7 p.m. Now, once you've completed Working with Doctors Part 1, we have 3 sessions this week for Part 2. Wednesday at 10, Thursday at 2, and Friday at 10. Okay? Now, we're going to be rolling these webinars every week at the same time. So all you have to do is pick a session. Now, if you don't have access to the training calendar, these will be posted later this week. Again, go to joinhpm.com/webinar, and they should be posted at the bottom here next to the Clever RX discount card as well. So those webinars will be live and rolling this week. So wanted to point those out. And one of the reasons being is because Mr. Nick Street is not going to be able to place you in a doctor's office if you have not yet completed those trainings. So please make sure that you get those trainings done, and so we can get you out there making some money. However, we've got other trainings for the week. So this morning, Devoted is doing a coffee and chat session at 11 a.m. This one's geared for the Orlando market, but all are welcome. You can join that at 11 today. Marketing support with Sergio, Victor, and Nick is still rolling every week. That is an open session call at noon. You can jump on that call to get any questions, concerns, or thoughts that you might have for your marketing support from HPM every Monday at noon. Moving on, we've got those ACA trainings, which I pointed out. ACA trainings are happening throughout the week. We've got one today at 1 o'clock, CleverRx at 3 p.m., and HPM Shop at 7 p.m. Again, those are going to be rolling webinars, so I'm not going to mention a bunch of those. Just going to point out a few things because we've got a lot to talk about this morning. Moving on to Wednesday, Humana is doing a training session, 10 steps for the sales process for Medicare Advantage. Now, I do have a video on this on our YouTube channel that talks about the sales process. However, in HPM Shop, we have made the sales process seamless as long as you're using it the way that it's been designed and intended to be used. But it's always good to get different perspectives on the sales process when you're selling Medicare Advantage plans. So Humana is hosting at 11 o'clock on Wednesday. You can jump on that webinar. Cigna is doing a training session on Wednesday at 4 o'clock. Medicare Compliance. Ooh, always fun. Medicare Compliance. Listen, we got to know how to stay out of hot water, right? So, it's always good to join those compliance trainings when and if possible. So there you have it. Moving on to Thursday, Devoted's doing another coffee and chat session. This one's geared for the Jacksonville market. That's at 11:30 on Thursday. But again, all are welcome if you have any questions on Devoted. So those are the trainings for the week. Just remember, we've got tons and tons of those webinars. So jump on to joinhpm.com, pick a webinar, and you can pick a time where we're going to be doing those. But just as a reminder, we have started a new webinar series, Working with Doctors, Part 1 and Part 2. So you can find those on the training calendar. If you do not have access to the training calendar, please reach out to a team member so we can get you connected, so you can have that on your phone, laptop, and iPad, so you're always in tune on what's going on out there for training. All right. So I'm going to stop sharing my screen here just for a moment and talk a bit about customer service. Now, this has become a very hot topic recently. Well, it's always a hot topic here because, in my opinion, you guys are the highest paid customer service reps in any industry anywhere in America. Okay. Many of you are clearing over 6 figures a year. Some of you have done phenomenal with your book of business and how you've grown it. But it gets to a point where you've grown your book of business and you're getting customer service requests, and that seems to eat up a lot of your day. Now, we're working on an incredible system to take some of that off your plate. But I will tell you that I'm seeing a lot of faults in how customer service is handled from your perspective. So I want to walk through the procedure, and this is a global procedure on what to do when you have a member that calls you and you need assistance, okay? Something that you can't handle on your own, something you can't guide your member on your own, okay? So the first thing that you must do if you must escalate the customer service issue, step number 1 is have the member call customer service. Now, I know we're all frustrated with the customer service. We're all frustrated and we're not happy with the level of customer service with certain companies out there. But I will tell you that it is necessary. You have to have the member call customer service first if you must escalate it. The reason being is because most carriers, I think almost all of them now, when you call customer service, have a CRM system and they create a ticket. And that ticket is a tracking mechanism to ensure that that issue's been resolved. Now, if you bypass customer service if the member bypasses customer service and you call broker support or you call a local manager or you send me an email, there is no way to track that issue. There's no issue in the system. They're unable to attack that issue because there's no ticket involved in that. So step one, please have the member call customer service. Now, in my mind, I would anticipate that the issue is not going to be resolved on the first call. Okay, so that's really important. Just know that mentally going in there saying, I know that this issue is not going to be resolved on this call, but you're not calling to resolve the issue. You're calling to get that ticket number. So once you have that ticket number and the member's issue has still not been resolved, then you're going to take that ticket number and then you're going to escalate it to broker support. So step two, call broker support. Now, I will say this, customer service usually takes 24 to 48 hours to get a response or give them time to correct the issue. Sometimes that does take a little bit of time. But, if you hang up the phone and you got a ticket number and you immediately call broker services, obviously that you didn't give them enough time to resolve the issue. If you get a good rep on the phone, they will tell you, hey, look, give us 48 hours, 72 hours to resolve this issue. Plug it into the CRM system and remind yourself that, hey, I'm going to be calling this person back or I'm going to escalate this issue through the broker support unit. And because now I've got that ticket number. And this is a great segue into using the CRM system because you can save that ticket number in the CRM system. So if you're not using the CRM system, please let us know so we can get you set up on that because that's really important. So save those numbers, those ticket numbers, because when you call broker services, let's say 3 days have passed, then you want to go ahead and use that ticket number to say, hey, look, I called Mrs. Jones. Well, we've got 19 Mrs. Jones in our plan. So no, I've got a ticket number. And then they're quickly able to pull up the interactions, what was owed to the member, and any resolutions there. It's all tied to that ticket number. It keeps it very neat and clean and organized as well. So that's really, really important to do. Now, so you've called customer service, and you have got a ticket number. You call broker support. You worked with them. There's still no resolution. Now the next step 3, if nothing's still happened, then you want to reach out to your local representatives, your local sales manager at the carrier or director or whoever it is in your market that you know. So for instance, if you have an issue with Aetna, you're going to remember step 1, call customer service. A member calls customer service, gets that ticket number. Then you call broker support and you're going to put that ticket number in. And then if nothing's happened since then we escalate with local management and then give them time to do that. Now, Gail has a great question. Should we 3-way call or have customer call on their own? Now, with the member services and customer service, some carriers don't mind that you're on the line with them. Other carriers do. So if you prefer to be on the line with your member, with member services, that's fine, no problem. But I will say broker services do not have the member on the line with broker services. So if you're calling broker services, do not have the member on the line for broker services. Member services, absolutely, they need the member on the line. But anything outside of that, please don't 3-way call them with the sales manager. Please don't 3-way call them with the broker services because the messaging and the communication is for you and not for the member. And so things can go sideways with that. So great question. If you want to do a 3-way with the member for member services, that's fine. But some carriers will ask you to exit the call. So just know that. Okay, so we've got a ticket number with customer service. There was no resolution. We went to broker services. There were no resolution. We went to local management. We emailed them. We called them. Whatever we did, there's no resolution. Now, please reach out to me. At that point, reach out to me. Send me an email, or send your agency manager an email, and we'll get together. It's really important that we walk through this procedure and with customer service, because our whole business is customer service, right? But you got to know that procedure. And I'm seeing folks that they're getting frustrated. A member calls and they call the local manager right away, and a lot of times the local managers are unequipped to resolve a dental issue, or unequipped to resolve a referral issue, because a lot of times these guys are on the road, or they're in meetings, or they're at a seminar, or they're doing a training session. So these folks are not geared towards resolving the issue for you. That's not what they're geared to do. They're geared to triage those issues. So when an issue comes in, hey, okay, I got to get this over to this department and I'll watch it. But they can't fix the issue for you. There's no way for them to do that. That's not what they're trained for. That's not their job. Okay. So, you know, 4 steps there in your customer service procedure. And I see that Tom has raised his hand, I believe. So I'm going to looking for Tom. And Tom, if you want to, I'm going to go ahead and take you off mute. I think you might have something to say. Nope. Okay. That's okay. So customer service is really, really important, um, and following that procedure. So once more, step 1, get your member to call customer service. Step 2, that hasn't been resolved, go to broker support. Step 3, if it still hasn't been resolved, go to your local manager. Step 4, if it still hasn't been resolved, escalate it up to us at HPM, or your agency manager. Okay, so we can get that resolved. So hope that helps. I know we haven't covered that before with customer service, but we're going to talk more on that as we move forward. And that's on every carrier, and that's global. So just keep that in mind. Next issue I wanted to tackle here on today's call is your responsibilities when it comes to ready to sell. Okay, we've run into a couple of snags here, moving in from 2021 to 2022. And remember, you are all independent. You all run your own business and your own brand. Okay, you are your own agent. Therefore, your contracts are individually with each and every carrier. You sign up with a carrier and you have an agent agreement with each carrier. And within that agent agreement, as you have read, I'm sure you read each one of these, you will read that it is your responsibility as the agent to ensure that you are properly licensed, properly certified, properly appointed for each and every product in each and every state. It is not your manager's responsibility. It is not Health Plan Market's responsibility. It is your responsibility. You must ensure that you know and have certified. You have confirmed that you are licensed, certified, and appointed for every carrier for each and every state that you represent. It is very important that you do this, okay? So if you have any doubt on your ready to sell, if you have any doubt on your compliance with any plan, please reach out to the carrier directly and they will confirm that you are RTS. This is especially important as we move forward into 2023. Okay, so typically what I do best recommendation here is, as you're completing your certifications for 2023, give them a couple of days, but maybe once a week, call that carrier and verify that you are RTS, and then double check your states. Okay. Now, some of you have non-resident licenses. Congratulations to you. I think that's a smart move. But you also need to ensure that you are RTS for each carrier in each one of those states. Just because you get a non-resident license in Idaho does not mean that you are ready to sell for each and every carrier. If you get a new license in a new state, it is your responsibility to inform each carrier in that state that you will be representing that you are now licensed, certified, and appointed in that state. And then they will send you a confirmation. Please note, you cannot sell in a new state until you receive confirmation from the carrier. Okay, it is not automatic. Just because you have Humana and you add Alabama, that doesn't mean you're RTS for Humana in Alabama. You're RTS for Humana in your home state, maybe Florida, but you're not RTS with Humana in Alabama until you tell Humana, I've added Alabama to my license and I'm requesting that you appoint me in Alabama. Okay, this is essential. Okay, we've had several instances where agents assumed that the carrier automatically knew that they have a new license in a new state. It does not happen. Now, we do our best because with our HPM shop quote and enroll tool, you're not going to be able to write Humana in Alabama, and you're going to call us and say, why can't I write Alabama? And we're going to say, because you didn't tell us that you were certified in Alabama. Excuse me. So you have to let the carrier know, and then once you get that confirmation, please let us know. So that way we can turn it on for you. Other than that, it's going to be very hard for us to understand if you're RTS in each and every state. So that's really, really important. All right. It's also important to know that if that happens, if you add a state and you do write the business and you're not in compliance, you will not get paid. And the consequences could be you could lose your appointment and possibly your license as well. So please be very, very careful with that, because obviously you're not going to get compensated. Now the carrier will definitely take your app, but there's no doubt about that. And they'll get the member enrolled. Unfortunately, you won't get paid. And if you're out of compliance, you could get a boo-boo. So if you have a big book of business with Humana and you're starting to write business in other states and you don't tell Humana that you're RTS in Alabama and you write a piece of business, you could lose your appointment with Humana globally, which means that could affect your business and your renewals. So please pay attention. Please put an emphasis on ensuring that you're RTS. One great practice that I've seen is create a spreadsheet. So if you have like maybe 3 or 4 states, on the top you put Florida, Alabama, Georgia, Ohio, whatever those states are. And then on the left side, all the carriers. And then just put a check mark. You know, I'm RTS. I got confirmation. If there's a ticket number, put that ticket number in there. Okay. Just best practice there. All right. Moving on to SEPs. So we're going to have a training on SEPs later on, so I'll keep you posted when that happens. But I will tell you that Health Sherpa has released some guidance on the SEPs for ACA business. And this morning, I'm going to go through those. So the first thing is the new SEP for those folks that are under the 150% federal poverty level. So starting in late March 2022, agents can enroll eligible clients through the new 150% FPL SEP category. Now there's an FPL chart here, a very basic one that you should see on the screen. For a family size of 1, you can earn up to $19,320. For 2, $26,130. For 3, $32,940. And for 4, $39,750. Through this SEP, new clients who fit this eligibility can enroll in a marketplace plan, and existing clients could change their plan. If an existing client chooses to change their plan, their deductible and out-of-pocket max will reset. Who is eligible for this SEP? Excuse me. Clients are eligible for the SEP if they fit both of these criterias. They have an estimated annual household income at or below 150 FPL, or are otherwise eligible for an APTC. As a reminder, consumers with income below 100% FPL, but who do not qualify for Medicaid due to immigration status only, may still be eligible for APTC if they meet all other marketplace eligibility requirements. They would also qualify to use this SEP. Who is not eligible for this SEP? Clients must be eligible for APTC in order to use this SEP. That means they cannot be eligible for Medicaid or offered affordable employer-sponsored coverage. This also means clients who are in the Medicaid gap, which is they make less than 100% of the FPL in states that did not participate in Medicaid expansion, which includes Florida, cannot use this SEP. Nothing about this new SEP changes their eligibility for subsidies. This SEP is live for the federally facilitated marketplace and all plans on Health Sherpa. Implementation of this SEP varies for state-based marketplaces. So you'll see a chart here and it states the California, Colorado, Maine, New Jersey, Pennsylvania, Rhode Island, just as some examples for the 150 FPL for the SEP notification. So what are the effective date rules? This monthly SEP will follow accelerated effective date rules, which means that you can enroll a client any day of the month and have their coverage start the first day of the next month. For example, if you enroll your client in a plan on March 30th, their coverage will begin on April 1st. Will anything be different in Health Sherpa for this SEP? There will be one noticeable change in the quota. If you enter an income in the qualifying range, you will skip the SEP reasons. So you'll see the step below here. So you're going to be able to skip this part here. All the questions in the application will remain the same. The application will automatically detect the SEP for clients with qualifying income. So you do not need to mark anything in the upcoming recent changes section of your client to receive this SEP. How do I know my client received this SEP? After submitting a client's application, you will see that they received the SEP due to estimated household income less than 150 FPL on the eligibility results page. There also may be a data matching issue, also called a DMI, for your client to resolve to prove their income. How long will the SEP last? For now, this SEP only exists for this year. It will only be extended if ARPA subsidies are extended. With ARPA subsidies, most clients who are eligible for this SEP can enroll in free silver plans. So that is the SEP guidance for Health Sherpa. And there is an SEP enrollment demo here as well. So if you go out to healthsherpa.com, I'm just showing you where I am seeing this, guys. So if you go to healthsherpa.com, and sorry, I've got I've got a cough going on this morning for some reason, but if you go to healthsherpa.com, there's a frequently asked questions, and you'll see the SEP enrollment overview. So that's what I was reading from this morning. Sorry if I didn't share my screen in time, but it'll pop you right down into the SEP guidance. So the new SEP category is right here. So that's what I was reading from this morning. If you didn't get a chance to see that, you can go out to Health Sherpa and they'll be able to do that. There's an SEP guidance. Also, I'm going to close this screen. When you log into your Health Sherpa account, on the top, it'll say SEP for Consumers 150 FPL. The new SEP Consumer FPL is live. For more information, click here. So that's where you just click here and you can get the same information that I just shared with you this morning. Okay, so pretty easy. Sorry if I didn't share my screen in time. My coffee was trying to take me out this morning. So I survived. All right. So we've got lots more to cover. Unfortunately, we're at our 9:30 deadline here because I know you guys are all busy. But we will continue the call next Monday, 9 o'clock. Thank you guys for being on the call this morning. Keep a lookout on our YouTube channel as we're posting updates there as well. If you're not subscribed, please make sure you take time to subscribe so that way you get an update and you get all that information live. So thank you guys for being on the call this morning. As always, if you need anything, please call us 844-696-3975, or you can visit us at joinhpm.com. Thank you guys. I hope you have a fantastic